Well, hello, house guests, and welcome to a podcast on pneumonia. We're going to go over a couple of things. First of all, warning, this is for entertainment and educational purposes only. This is not a substitute for medical or health advice. Please consult your medical provider in regards to your health. This is not to be taken as medical advice. So I wanted to do a video on pneumonia, basically from symptoms and diagnosis to prevention and when to see your medical provider, just for general educational purposes only. And because it's been brought up in the media that Diane Keaton, she's recently passed away at the age of 79. The family said it was from pneumonia. And that she was found down. And I guess some family members say that she was dealing with an illness prior to the pneumonia. So we're going to talk about pneumonia, specifically bacterial pneumonia, and diagnosis, treatment, prevention, outpatient, inpatient, and things like that. So first of all, what is pneumonia or bacterial pneumonia? So pneumonia is an infection, okay? And it affects the air sacs in the lungs, okay? And it can affect one lung or both lungs, okay? It can fill with either fluid or pus, and it can lead to symptoms such as coughing, a fever, chills, and difficulty breathing, okay? It inflames the air sacs, so, you can have some respiratory complications along with that, such as an impairment of oxygenation, which would lead to the difficulty of breathing, okay? So, and I'm just going to pull out my notes right here real fast for you. Sorry, guys. I thought I was a little bit more organized than this. Okay. So, we went over what it is. Let's go over a diagnosis and what you would do for a diagnosis. So, if you have a cough and it's producing phlegm or sputum that is a dark green in color or yellow in color, that's a pretty good indication that you have some sort of infection going on, whether it's upper respiratory or lower respiratory. It would always be good to consult your medical provider if you have sputum, spit, mucus that is a different color, green or yellow, okay? And the great thing about sputum and things like that is the darker the color, you could notice the severity of infection, to the lighter of color where you notice a lesser of an infection. But that's a different video, okay? So anyways, diagnosis. How are you going to diagnose these things, or how are doctors going to diagnose these things, okay? But first, let's go over to some other symptoms that I forgot. So as far as symptoms, you can have chest pain when you breathe or cough. In the elderly, which I mean the population of 65 or older, you can have confusion or changes in mental awareness. Maybe they are sleeping more and they're less aware of their environment. Maybe they might be hallucinating. It wouldn't be an unusual symptom to see in the elderly. Again, we talked about cough that produces sputum, and you're going to feel fatigued because you are fighting an infection. You are sick. You're going to have a fever. You could have some sweating and some chills. Or you could actually have a lower than normal body temperature if you're an older adult, or if you have a weakened immune system. And, this could also cause some nausea and vomiting or diarrhea, depending on the what is affecting your body, and you can have shortness of breath. Okay, like I said, we are going to cover bacterial pneumonia exclusively. We can cover different types of pneumonia as well in other videos. There's hospital-acquired pneumonia. There is aspirational pneumonia. Okay, but as far as bacterial pneumonia, the course of treatment is fairly standard. Normally, or you could expect at least, and again, this is up to your provider, to prescribe some antibiotics. Okay, again, this is a bacterial if this is a bacterial infection. A viral infection, antibiotics would not work in that case. So with antibiotics, you do want to take the full course. So even if you feel better after 2 days of taking antibiotics and you have 5 more days to go, continue taking that course of treatment, okay? Just so you don't have a rebound reinfection, okay? Maybe because it may not be already gone. But anyway, typically doctors are going to prescribe antibiotics like we just talked about, and then some other supportive treatment medications such as cough medication if you have a severe cough, fever reducers, and pain reducers, okay? That does include some medications like Tylenol, ibuprofen, Advil, and this is a very open conversation that you should be having with your provider about your treatment method and what you're comfortable with, okay? Because you need to be treated holistically as a whole person, right? Holistically. Okay. So typically, if you're going to be treated outpatient, you would be taking an oral form of antibiotics, a common form that some medical providers may provide. Again, this is a conversation with you and your doctor, but this is one oral form of an antibiotic that one might get if they have pneumonia. This is called doxycycline. It comes in a variety of different names, okay? But doxycycline is an oral medication that you can take. It's an antibiotic, okay? It's also used to treat other infections in different parts of the body, so it's not exclusive to your lungs or your respiratory system, okay? And doxycycline comes in a variety of different forms, from capsules to delayed release capsules to delayed release tablets, okay? And it actually can be used in hospitalization too, but for this, we're just going to focus on the oral form and what you might get from a provider if you saw them for, if they deemed that you had pneumonia. Oh my gosh, we didn't even go to diagnosis or chest x-rays or anything, so we'll go back to that, okay? But typically with doxycycline, you want to make sure that you don't have an allergy or an allergic reaction to this medication. So whatever allergies that you have, please report to your medical provider before taking anything, just so that they know and that the record is up to date, because sometimes your records are not going to be up to date, okay? And just with some considerations, we're going to kind of take some of like the characteristics that hit the news as far as age in the elderly. Geriatric is considered 65 and older, and there's 3 different stages in geriatrics, but that's a different video. But as far as the elderly, you want to be concerned about their kidneys and liver and if they have any heart problems, okay, which might need adjustments in dosing. As far as drug interactions, you want to make sure that you're telling your provider all of the medications you're on, and you might want to even consult the pharmacist and bring that up about what is safe to take with this oral medication or not, okay? It's usually not recommended to take this medication, like say with amoxicillin, ampicillin, and Eliquis. So you really want to make sure that your medications are up to date with your provider, okay? You don't want to take this medication with heparin. It might be a concern. And these are just all conversations to have, okay? So, let me go back to diagnosis. I am so sorry that I did not go through that. So, for diagnosing of pneumonia, when you see your doctor is, of course, you're going to take a baseline your vital signs. So a temperature, blood pressure, a pulse rate, a respiratory rate, and a pain level. The doctor may listen to your lungs for specific lung sounds, such as crackling sounds, like Rice Krispies. If they hear that in your lungs, that's a pretty good indication that you might have pneumonia, okay? Or a bubbling sound, okay? Because that would mean that you have some fluid that's kind of covering those air sacs. Also, you might get a chest x-ray, some blood tests, and another thing you might get is pulse oximetry levels. So this measures the oxygen level in your blood. Now, this is important because pneumonia can prevent your lungs from moving enough oxygen into your bloodstream, okay, which is very important. So if you have a pulse oximeter at home and you notice that it's in the low 90s, high 80s, please call your provider or go to your nearest urgent care or emergency room. That is abnormal and you may need medical assistance, especially if you're feeling lightheaded, dizzy, or even anxious, like your heart's going to be out of your chest. So now that we went over diagnosis and treatment, like on a outpatient basis, if you need hospitalization or a higher level of care, such as inpatient, then you might experience some other supportive interventions other than antibiotics. Like you may need oxygen that the hospital need to be providing, or you might actually need IV antibiotics or intramuscular antibiotics for a certain duration or period of time. Okay, maybe like 3 to 5 days or 3 to 7 days. A common medication that you might get with pneumonia in the hospital, either by IM or IV, is a medication called ceftriaxone, or another name for it is Rocephin. Okay. Now, Rocephin is an antibiotic. Okay, it can also be used for different parts of the body. Okay, it could also be given prior to surgery to prevent infections. Rocephin or ceftriaxone belongs to a certain class of medications. Okay, this class is called cephalosporin antibiotics. So there's several types of antibiotics that you can get. This is just part of the cephalosporin class. And antibiotics work by killing bacteria and preventing their growth, okay? Antibiotics will not work for colds, and it will not work for the flu, and it will not work for other viral infections, okay? And ceftriaxone is only available by doctor's prescription. If it's given by IV or IM, it should be a medical professional giving it to you. You do have to consider your allergies, so make sure that that you tell your medical provider about your allergies. Okay. Let's see, what else do we got? So in the hospital, you also might have multiple people on your hospital team. You might have a hospitalist who's the main doctor on your team. You might see a respiratory therapist who's going to support your breathing needs, including oxygen needs, breathing treatments, and that will require different medications. You might also see an infectious disease doctor either by telehealth, like an iPad, or by video, or by person. And that is the person who's monitoring the course of your antibiotics, the type, and how well you're responding to it. They might order additional blood work while you're on IV antibiotics in the hospital, and that is just to like monitor, a white blood count, which is a good indication of infection. They might want to monitor your kidney status as well to see if these medications are interfering with your kidneys. So they might be in these infectious disease doctors may be following through the course of your hospitalization. Okay. You might also see a pulmonologist as well. Okay. And depending on the hospital, what services they are, bigger hospitals are going to have bigger departments and more different types of doctors. So you might see a different doctor than what I'm covering now, depending on your situation, location, and whatnot. Now, let's go over to prevention and what you want to do in order to prevent pneumonia. Okay, so a really good way to prevent pneumonia in the elderly is to get vaccinated. Okay, if you're 65 or older, I highly recommend you talk to your healthcare provider about getting vaccinated to protect yourself at least against viral pneumonia. Okay, another good way is to wash your hands. I know that it seems like a crazy concept, but it's the easiest thing to do. All right. And avoid people who are sick. If you're not feeling well, do not push yourself. Take that time off to take care of yourself. Have an open conversation with your doctor about any symptoms that you're having, especially if you have that different colored phlegm. If you're having difficulty breathing, it is a 911 phone call. It is an urgent care visit. It is an emergency room visit, okay? And I hope that covers pneumonia from symptoms to prevention. Another thing you can do to support your health is zinc, vitamin D, a multivitamin. Stay hydrated, so make sure you're drinking your fluids. And if you like this video, please subscribe, share, comment, and like. Thanks, house guests. We'll see you later.